Hi guys, Heather here. Today's video request comes from Mallory. Hi Mallory, and she was wondering how to complete assessments on 4 patients and give meds all in a short amount of time. Like from 7 a.m. to 10 a.m. if you work mornings like I do. And you know what? It can be very challenging. So my routine goes something like this. Like I said, my shift starts at 7 a.m. So I get a report from the night nurse who's dying to go home because she had a crazy night. She tells me that the patient's potassium was 7.3, so she just gave him Kayexalate. And my first thought is, great. We all know what that means, right? Kayexalate being a laxative? Yeah, that's right. So my first priority in the morning is to go into all my patients' rooms and introduce myself so they know who their nurse is and ask if they need anything like pain meds or help ordering breakfast. And since it's so early, a lot of times some of the patients are still sleeping, so I let them sleep. But for those patients that are hooked up to a lot of stuff like tube feeds and chest tubes and drains, I'll assess those patients first, but if they're not really hooked up to anything, then I'll just come back, after I assess the patients that are awake. So for the patients that are awake, I usually go and do my head-to-toe assessment on them first, like we're taught in nursing school, and then I ask when they like their meds, because some like to wait till after they eat and have something in their tummy, but if they don't have a preference, then they're the ones who get their meds first. And sometimes patients have like 20 meds, and after they take 5, they're like, how many more do I have left? And I'm like, hey, you got like 15 left. And then they're all surprised and exhausted from the meds they've already taken. Sometimes just watching them take all those meds makes me exhausted. Then I go wake up the patients that have been sleeping and repeat the same process. However, in the real world of nursing, things don't always happen in a nice controlled time frame. Patients might need something right away. They need help to the restroom. You have a confused patient climbing out of bed, setting off his bed alarm. You have a patient going down for a procedure or surgery. And there are some days when I'm trying to get that last assessment done and pass that last set of meds, and it's like between 10 and 11 o'clock. So let's face it, some days things just don't go according to your plan, right? So don't stress out if you can't get all your assessments in and meds passed by 9 o'clock. Some days it's just not possible. So what do? Well, you can make a list of everything you have to do, right? Because sometimes there's just other stuff you have to do besides assessments and meds in the morning, and you just check it off from like most important to least important. Eventually you'll get there. But you just got to go down the list and complete the things you need to complete until they're all done. And sometimes you have to do quick assessments on patients, like if they're going down for surgery in the morning, so you can ask them their orientation questions, check their pupils, their heart, lungs, bowel tones, pulses, edema, and these things you can do fairly quickly. And I promise you guys, I know it seems like a lot in nursing school and it's overwhelming, but the more you do it and become comfortable with it, it will get easier. Seriously, it will. Well, thanks for watching everyone. Have a great weekend, okay guys? And I'll talk to you later. Bye!